All right, we'll go ahead and get started here. Welcome everyone to the ArMA weekly COVID-19 virtual town hall. A little Zoom housekeeping real quick. This is a professional environment and we ask that everyone remain respectful towards all participants. This webinar is being recorded and will be published at a later date for you to view. You can see and hear us, but we cannot see or hear you as a participant. The webinar is best accessed through a computer and utilizing your screen and the options in the Zoom window. And we ask that you do, if you have any questions throughout tonight, that you please submit your questions through the Q&A function that you will find on the Zoom platform. And the best viewing option is for you to view by fitting it to your window. Quick little introduction of moderators tonight. You have myself, Damian Johnson, ArMA's Director of Communications, as well as Megan McCabe, ArMA's Deputy Director of Government Relations. Our panelists tonight include Dr. Patrice Harris, AMA's President, Dr. Ross Goldberg, ArMA's President, Libby McDaniel, ArMA's CEO, and John Amores, ArMA's Director of Government Relations. And at this time, I'm going to go ahead and turn it over to Dr. Goldberg for a quick update from ArMA.
Thank you, Damian. Good evening, everyone. Thank you all for joining us tonight. Obviously, a week makes a difference. It's a very different tone than what we had last week. I'm not going to comment on much of that. I'm going to leave that to our panelists, our guest panelist today. She has a lot more about to say than I do. I will refer everyone to the statement that ArMA put out yesterday, as well as the AMA statement on everything that's been going on recently. I want to take a minute just to let all the people participating know of the relationship between the AMA and ArMA, because there is a good, robust one there. The AMA, like our ArMA House of Delegates, has a large House of Delegates that makes policy that helps guide the decisions and the voice of the heart of medicine, if you will. We have a delegation that goes and represents Arizona at that AMA House of Delegates, which is made up of state societies and specialty society delegations. We're very fortunate to have a very strong, supportive delegation. Ronnie Dowling is our chair, Zudy Jasser, Dan Asbury, Gary Figge, Tom Hicks, Mike Hammond, Tim Fagan, Mark Lieb, and the new doctor, Elise Molinar, our current delegation, as well as myself. Two will be stepping out, and Jen Hartmark-Hill and Jacqueline Hoffman will be taking over as we move forward. We're representing you on the national level to make sure Arizona's input is there. But besides the House of Delegates, we also have a relationship where the AMA has significant resources that we're able to help on our state advocacy level, as well as provide a voice on the federal level as well. And also with scope of practice fights. As you know, we've been in a few of those the last couple of years. The AMA has a whole scope of practice resource center that we have access to with experts that provide legal advice, support, resources, sometimes financial resources if we can partner together. And we've been very fortunate to have that relationship and be able to accomplish many things together. So we really are quite lucky tonight to have Dr. Harris here. It is a coup, I think, on our end to have her speak to all of you tonight. So we're very grateful for that relationship. I'm going to be stopping now because I'm not here. I'm not the one here to see. She is. So I'm going to let Dr. Harris take over, highlight the work the AMA has done through this pandemic and the last week. Without any further ado, Dr. Harris, please, the floor is yours.
Well, thank you, Dr. Goldberg. And I know that Dr. Dowling is on. I saw her with the message, and I want to thank all of you, first of all, for all of the work you do every day, taking care of your patients, whether it is in the emergency departments and hospitals and ICU units, or, you know, as we begin to make sure that our patients who have postponed needs, of course, I know that many of us started seeing our patients through telemedicine, but we know there are some needs that just can't be taken care of through a video conference. And I know that everyone is gearing back up to take care of those unmet needs. You know, today I taped my last sort of AMA COVID update with Todd Unger. And it was an opportunity to look back, as many of you know, on Sunday, we will install our new president, Dr. Sue Bailey, and my tenure will end. hopefully everyone can join the meeting. At least I know there's a delegate part, but at least my final speech and Sue's incoming speech will be, I think the plans are, let me under promise and over deliver. The plans are right now to at least have that portion available for a wider audience to view. But certainly as I look back, last year around this time, many of us were in Chicago, and in my inauguration address, I was talking about the fact that in addition to, of course, the wonderful work that AMA does in partnership with our states and specialties, I wanted to amplify three things. One was the importance of mental health into overall health. The second was the importance of increasing diversity of the physician workforce, but why? Not just for numbers, but in the service of improving health equity. And then the third was making sure we had a robust conversation about trauma. Now, those are the things that I had planned to elevate. And of course, no one dreamed and wished for this COVID-19 pandemic, but isn't it interesting that all three of those issues are interwoven with the current COVID-19 pandemic? And then of course, over the last month or so, particularly in the last couple of weeks, we've seen this elevated awareness for some, continued recognition for many of racial injustice in this country. And that matters, and I'm happy to talk about this more at the end. I'll raise it a little bit in my talk, but that matters in health, because physicians, we are on the front lines. This was a broader conversation around why should physicians worry about and learn about the social determinants of health. And I think these are all determinants of health. And we are all on the front lines of seeing those day in and day out, acutely, whether it's a result of violence or long-term, because we do know that trauma and traumatic experiences early on lead to health impacts, and not just mental health impacts. Of course, I'm a psychiatrist and certainly happy to talk about that, but we know from research that there are impacts on cardiovascular disease and diabetes. So we see this. Again, this is not our problem alone to solve. I'll probably say that again a little later, because I know we have a lot to do, right, on physicians. And we should say, yes, we know about it, but we need everyone else to help us. And there's certainly no issue in us saying that. But of course, we have to be a part of the solution because we see it every day. So I am going to do something that I have never done before. We were just talking before we went live about the fact that, we're learning a lot, lots of learning moments, but on a personal level, we are, again, pulling back a little bit of our perfect veneer that we would put out on social media, and we're seeing all the things that can go wrong. So I'm going to try to share my screen for the first time. So let's see how that works and go through my PowerPoint, and then of course we'll have time for questions. Are we having success?
Yay.
Very good, very good. So I talked a lot and have talked really over my career in organized medicine around the importance of physician leadership. And in fact, some of you've heard my story. I have wanted to be a physician since I was in the 8th grade, and Marcus Welby was my inspiration. And I saw in Dr. Welby, not only was he a leader, of course, and helped patients inside the exam room, he was a leader and cared about his patients outside of the exam room. And so I've been talking about leadership a lot during my career, and certainly over the last several years, and have made several presentations to the AMA House of Delegates and around the country to state medical societies on the importance of physician leadership in times of crisis. And I said this, I was given this talk even pre-COVID because we were seeing other crises, even with crises in a healthcare delivery system and intrusion into the physician-patient relationship. So certainly it is critical for physicians to be involved and to demonstrate leadership in this time. Now, I don't know how many of you were at my inauguration just again this last year, but here's one of my favorite photos. And these are a few of the men in my family. And I think this photo is emblematic of a lot of things. Of course, these men my family had a great time at the inauguration, and of course my family members, as everyone's family members is welcomed, given that huge AMA warm welcome. But if we look here, I can tell you that if you look in this photo as representative of communities of color, there's a story here. There's a story regarding racial injustice and police brutality that we've seen just in the last couple of years. The ability to simply drive around this country, the disproportionate impact of chronic disease, the disproportionate impact of cancer, a lot of issues. And I know I join you, the AMA joins you, I join you personally in our fight against racism in all of its forms, and again, appreciating the impact of the structural determinants of health, which have led to the social determinants of health, again, which have led to so many health inequities. So I think that one of the things I learned early on in my career, going down to the Georgia General Assembly, was data is important. And we've talked about that a lot, but it's the stories and the narratives that really grab a lot of our legislators and a lot of folks. And so this is a story. This photo of my family hopefully tells a story. Folks, of course, tonight, you all know these stories, but I just wanted to show this picture because there are so many stories on this picture, and I hope it is just continued impetus for us to, of course, talk about the science and the data, but talk about the stories of our patients, our individual and unique stories, so that we can all work together to improve our health system. Hopefully, if many of you had the opportunity to see my address, I gave an address through the National Press Club. It seems like 2 months ago. I'm not sure. I think for all of us, the days are just running into one another. But we knew early on, we talked about the fact that we needed to make a statement and a stand and take a stand, that we needed to make sure that science and the evidence and the facts were driving a lot of decisions. We all know that we are living in a hyper partisan environment, a political environment, but for COVID-19 and for violence and structural racism, all the things that affect health, we have to let science and the data drive the discussion. All of us can have our individual opinions, and certainly that's one of the things I love about the AMA on so many levels, but particularly the House of Delegates. It's such a diverse organization. By the way, I think that's one of the many reasons that our policy, you talked about your strong policy and your House of Delegates in Arizona, I think it's why it's one of the many reasons why our policy is so respected. The people who know that it's not just a small board of 21 members. As you know, the board does not set policy, but it's representatives from every state and every specialty of all age groups, women's physician section, senior, academic physicians, integrated physicians, making policy. But our policy, as we all know, starts and ends with science and the evidence. And we do have fair-minded, science-based debates, and then we vote on policy, and that is our policy. I have had the opportunity to show the work of AMA on CNN, MSNBC, Fox News, multiple radio stations, and I have always made the point that we need to keep science and the evidence and the facts in the forefront of all of our work. We wanted at the very beginning to be a trusted source of information. It's even a little sad for me to say this, but I think we all know that some of the usual trusted organizations that we would normally look to and lean on in times like these have unfortunately been mired in politics. And it's very sad. But again, that's why it's so important for physicians, the AMA, ArMA, to really make sure that our patients and really everyone sees us as trusted sources of information, not political, but just the facts. Again, we can tell those stories, but we wanted to be that trusted source of information. And in fact, I got a call even yesterday saying, could you all give a daily, could the AMA give a daily press conference? And of course, we are not going to do that, right? That's not our role, but and this was a non-physician, but just evidence that we are trusted and we are needed. Unfortunately, again, through our work and these COVID updates, and I'm sure what you all are doing, we are getting that information out, but that's not our role. But we can continue to request that our institutions, the CDC, the NIH, the WHO, are allowed to move forward and out of the political fray. We certainly wanted to make sure we were listening. I have been on social media. You can imagine, I get emails and texts, and I'm supposed to do that. And I've always valued that from physicians, listening to those stories so that then the AMA could put those give voice to those concerns and really develop solutions. And that's what we've tried to do from the very beginning. And of course, again, advocate for physicians and patients, no intrusion into that physician-patient relationship, and to reduce obstacles. If you have not, please go to our COVID Resource Center. It's our URL / COVID-19. We have been committed to putting a lot of resources out there, mainly for physicians, making sure that physicians know the latest regarding telehealth. JAMA, I have to compliment Howard Bachner and our JAMA network. They have been very active interviewing everyone. I actually watched a little today, Joshua Sharfstein talking about children in schools and when should we open schools. And of course, Dr. Anthony Fauci has been on. So I really commend Howard and the JAMA team around. It's about all of us working together to make sure that physicians have the information that they need. This is a novel coronavirus, a lot we don't know, but there's a lot that we do know, and we need to make sure we get that information out there. At the very beginning of this pandemic, I and a lot of other medical leaders were invited to go to the White House and meet with the president and the administration. That was about the time we really started to worry about travel. And so we decided as the physician leaders of this country that we would model what we thought was the best safety measures. And so we decided that we would not travel. We would not get on an airplane. Many of us would not get on the airplanes to fly to DC. Now we'll share with you a funny story. I was worried about getting on a plane. Although I live in Atlanta, lots of planes. I may have been in one of 3 on a plane. So I may have been able to socially distance and all that, but I would have still had to go through the process. And so listen, I think all of you know that I'm a psychiatrist, worked in public sector. So let me let you know, I do not have a private plane. But I said, I live in Atlanta, and there's 6 degrees of separation for everything. So I've got to know somebody who knows somebody who knows somebody who has a private plane and can get me to DC at a reasonable rate, right? For AMA, no more than a first class plane ticket, perhaps at the last minute. And you know what? I did. I was able to do that. But we decided as good physician leaders that we would take this call with the president and the task force by phone. So darn it, I lost my opportunity to fly in a private plane, but oh well, maybe there'll be another one. But we have from the very beginning advocated for PPE. We heard the stories on the frontline physicians, and I don't need to tell you all this, who were reusing PPE, in normal times that would violate infection control procedures. And so we really advocated for that. I talked to the president about that. We asked him early on to invoke the Defense Production Act so we can get the test kits that we need along with the equipment. And we know, though, that shortages were risking the lives. We heard the stories of physicians who were rewriting wills and living in basements or hotels so that they wouldn't infect their families. And so that was so important to do. And by the way, I think you all know in the beginning, some physicians were facing retaliation and even punishment for just talking about facts that most everyone knew. And so we spoke out strongly against that. We certainly wanted to make sure that we were working with CMS to remove some of the burdensome regulations for remote care. so many burdensome regulations at CMS. And by the way, this is what CMS and SEMA Verma were very receptive. And I hope that many of you were able to see your patients using telehealth in a way that was much less burdensome. Now, I will say this, and I think you all know this, we are in a time of crisis, and in a time of crisis, you do different things. You have to do different things. We have to be clear, though, and lead the conversation. Not everything we're doing in this time of crisis will we need to continue to do, right? And so we, of course, may not want some of the rules that have been relaxed to continue. I imagine there will be some that we do want and some that we don't. And so again, we'll have to be engaged and involved in that conversation with I think, patient outcomes at the center of that. You know, I've been using telepsychiatry for a while, and some of my patients don't like it. So I don't think we should say now we're moving to telehealth and that's just the way it's going to be. It's patient preference. You know, I know that not in this room, of course. Forget that psychiatrists, you know, go to medical school. And I was sharing my story, I remember, with one journalist. I said, you know, I go out and greet my patients and walk them back to the exam room. I'm looking at their gait. I'm looking if they're stiff, because some of the medications that I prescribe frequently alter gait, cause muscle rigidity. I'm looking at thyroids. We're all doing that. The non-physicians in the room, don't get paranoid, particularly for psychiatrists, because I'm not analyzing you. But those are the things those little nuances that you sometimes miss. So I think we in this room know, we're knowledgeable to know that it is not a one-size-fits-all a solution, telehealth. And by the way, it should be, in our opinion at the AMA, and I know you agree, in the context of a medical home, right? Care, not fragmented. We don't need telehealth to further fragment care. So those are the conversations we'll have. We fought for over $100 billion to cover the costs in the CARES Act, the small business loans. I was on several calls with legislators, senators, congressmen and women about many of these pieces of legislation. And we just kept hearing physicians, and when physicians said this is not working, we went back, and this is not working, we went back. So, and we were able to get the revenue, 1 month revenue in advance for patients as well. I've already talked about the unequal impact of COVID-19. COVID-19 really put in stark relief health disparities and health inequities in this country. Many of us in this room knew about it already, but again, the COVID-19 pandemic put that in stark relief. And that's why the AMA urged early on, again, to get the data, collect the data, every state, CDC, race, ethnicity. And by the way, not just race and ethnicity, gender and zip code, right? Because if we were able to identify if there was a particular outbreak in a particular zip code, we can go to that zip code and test and track and really potentially mitigate the spread. So we need the data. You know, people talk about getting back to normalcy. I actually, even on this slide, we should probably not talk about normalcy. There will be a new normal. And I know some folks originally, I am one included, thought antibody testing. Once we get the antibody test, if I get the antibody test, I'm smooth sailing, but we all know that that's not an immunity passport. We know that there were a lot of problems with a lot of the tests. And that's why the AMA talked about having a national system to track what's going on. And we put out a pretty stern warning I think about 3 weeks ago regarding these antibody tests. We really have to make sure that we learn some lessons from this COVID-19 pandemic. So I am going to stop sharing, and maybe you can see me and others, and I will be able to take questions. But I think the takeaway is this was absolutely a learning moment for our country, and there are so many lessons learned. But I will say, I see a thread woven through all of this, through the pandemic, through what we've seen regarding police brutality, and that is preparedness and being preventative and proactive, sort of the 3 Ps. We were not prepared. And I was a public health director for many years, and we went through some emergency drills. We know public health has been underfunded. So we were not prepared. We have to make sure our mental health infrastructures are better funded. That's a learning moment. We have to make sure private practices are viable. That's a learning moment. You know, a lot of rural areas depend on one or two physicians who are in private practice. That's a learning moment. We have to move forward. And finally, we need to be proactive regarding the determinants of health. There were conversations out there before about police brutality, about racism, structural determinants of health, and we didn't take the time to have those tough conversations and learn from them. And so hopefully this is a learning moment going forward, and we can have conversations around all of those issues and much more. So thank you for allowing me time this evening, and I look forward to your questions.
Thank you, Dr. Harris, for that great presentation. We're going to go ahead and jump right into one of the questions that was submitted prior to the start of tonight's event. Private practices are still finding it impossible to obtain N95 masks and are worried about long-term telephone, telemedicine reimbursement, as well as other issues. What is the AMA specifically doing to help moving forward?
We continue, and this is where the partnership, and I've said this about so many things, and people would say, well, what is that the AMA doing? And that's a fair question. But when I would go around the country to state medical societies, I would always say, and what are we going to do? You know, here in Georgia, again, you heard me tell my story of my involvement early on. We won a lot of legislative battles in Georgia. We won liability reform in Georgia because medicine was united. Medicine was united, state, specialty, all across the board. And so this is all of our responsibility, and some of these battles require that partnership, which, you know, I think the AMA partnership with Arizona Medical is model for that. We will continue every day. You know, we have a huge DC staff, talk with the president, but this is important. Talk with your senators and Congress people, let them know when you don't have the PPE. Candidly, senators in Arizona and the representatives in Arizona care more about what you all say than me, right? My Georgia folks care about what I say. So please continue to let them know that you don't have what you need, because, you know, there are some folks, I've heard some stories that said doctors have what they need, or doctors don't need, they're hoarding. Actually, you know, most of you know me, with those of you who know me, I'm pretty even keeled. But when we were accused of hoarding supplies and lying about the supplies that we need, I got angry. I got really angry. So we just have to keep the pressure on about these supplies, and we have to make sure public health is funded, the strategic national stockpile is funded, and so there's a supply chain issue. Now, you know, some of these things are out of our control, and this is an all of nation approach because a lot of our supplies came from other countries. And again, I'm not a geopolitical expert. I'm not even going to get into that, but I'm just saying we need to make sure that our legislators, our elected officials know that that impacts us. So it's their responsibility to understand the geopolitical environment to make sure we have what we need. So, and you know, and our companies here can ramp up production. So please, let's keep the pressure on the administration to invoke the DPA so we can get the supplies that we need.
Great, thank you very much. Next question submitted live this evening. Local public health workers in Washington state have reported hostile threats and fears about contact tracing. In addition, it's recently been reported that only about 50% of Americans would agree to get a vaccine should one become available. What's the role of physicians and organizations like ours to address public opinion on these topics?
I think, again, working with like a joint statement from your from state societies and your local public health officials, or county medical societies and the local public health officials. In our offices, when we see our patients, talking to them about the importance of getting tested if they, of course, need to, or maybe it's through a teletriage visit, but saying, yes, it is important that public health gets your information, and they are not, it is the government, yes, it is the government, but they are not going to use the data in any way other than health. Now, all of us have to make sure that they don't use the data, right? That only, and this is where privacy and confidentiality and what we have to continue to make sure is the #1 priority. But we have relationships with our patients. As I said in my November address, patients still trust us. And so if we can let them know that it's important to get that information and do trust your local public health officials, I think that will be helpful, in addition to advocating for more funds for public health. And what was the second part of that question was?
The second part of it was about vaccine hesitancy.
Yes,
so.
yes. Well, I am quite worried, as I think we all are. At the AMA, we talk about vaccines all the time. So we know that we come to this with the foundation of a lot of misinformation and disinformation. So when we see misinformation and disinformation, and you see it locally, and again, I would not recommend, and we don't do this, get into a battle. Patrice Harris is an anti-vaxxer, and so don't get into a battle with Patrice Harris, but just get the facts out there rather than going tit for tat on the anti-vaxxers. But let them know what we know about that, and let them know that we are advocating for vaccines development and research to be as fast as we can, but also it must be a safe vaccine. And that should be our stance, that it is our obligation to make sure that vaccine developments occur in a rapid manner, sure, but also in a safe manner.
Thank you, Dr. Harris. I just want to remind all participants as we go through these, if you have questions that you would like answered, please do click on the Q&A button to submit your questions, and we'll be sure to try and get to all of them. I'm going to jump into another question here. What do you think the AMA can or should do to address the healthcare disparities, including those on the Native American reservations, given that those are closely related to lack of basic items like running water, recently demonstrated by the COVID-19 data?
So for those of you who don't know, about 2 years ago, the AMA established the Center for Health Equity, and we hired our first Chief Health Equity Officer, and that it was from policy through our House of Delegates. Her name is Dr. Aletha Maybank, and she has really hit the ground running. I think there is another webinar tomorrow. We have had, I believe, at least 10 webinars on, again, the unequal impact, the social determinants of health, and they have focused on specific communities. And we have certainly done a lot of advocacy for our Native American, both our colleagues when they were just being discriminated against, but also making sure and advocating for appropriate resources for the Indian Health Service. And so we will continue to advocate for that on the AMA level, and continue to have these policy discussions to elevate that. And I know that Dr. Aletha Maybank, and by the way, the Minority Affairs section, Dr. Siobhan Westcott is chair of the Minority Affairs section, and very engaged and involved in working for and fighting for resources in our Native American community. We see that, again, the disproportionate impact there. I know Dr. Barbara McEnany has raised this issue. She's an oncologist from New Mexico, and she sees a lot of Native Americans in her practice. So we just need to continue to elevate those issues and fight for funding. And elevate, you talked about running water, right? So that is one of those things that some might say, I'm a doctor, I can't fix running water. I don't have a prescription for running water. But as physicians, or this person who asked the question knows that running water, or the lack thereof, or clean water or clean air affects health. And that's where we fit in, elevating these issues so that people know that these things do affect health.
Thank you, Dr. Harris. Dr. Goldberg, I believe, actually has something he wanted to ask as well and address.
Well, first, again, thank you for that great presentation, Dr. Harris. And I'm going to throw kind of a little bit of a challenging question out there, one that I face also here with ArMA, and that's specifically something I referenced to, which is the events in this past week, which you were mentioning as well briefly. And an interesting discussions come up from some of our members' questions about the role we play in all of this. And what I mean by that is that, we released a statement as well, similar to what you had co-authored with Dr. Ehrenfeld, regarding just an overall view of issues. And I'm not talking about specifically the health disparities maybe, but a little more detail about it. And I guess the question comes that really all the members ask is, where do we as organizations draw that line, if there is one, on commenting on public events like this, these national events that occur that require a response, but where do we as professional medical organizations have that line or that ability to navigate such a complex issue that obviously goes outside of just a medical problem? I'm curious what your thoughts are regarding all of that and how we fit into that space.
Well, I do think that we comment on issues that impact health, candidly, as physicians, as you asked me that question, I'm wondering, might there be a social issue, and someone can think of one maybe that doesn't impact health? And I guess I would say, if there is some social issue that doesn't have an impact on health, perhaps we don't comment on it. The recent issues around racism, we know racism impacts health. We know the trauma, and let me just be a little bit personal here. I am an African-American woman, and I'm not okay. And I don't mean personally. I'm okay. I'm talking to you. So obviously I'm okay. I have a support system. I'm a physician. I have a certain level of privilege in this country. But I am not okay when it comes to the fact that I can no longer be silent about issues that impact health. And racism does. Structural racism does. It impacts health. It is a determinant of health. It's traumatic. It's traumatic for the person, obviously, almost a little silly to say, who is experiencing the violence and the trauma. That's the same as intimate partner violence that we talk about, domestic violence. We talked about gun violence. I know it might be a difference of opinion, but again, when it impacts health, we know that these traumas then significantly not only impact health immediately, but they impact health in the long term. And so for those who want more information about the impact of health, I think everybody knows about ACEs, the Adverse Childhood Experiences Survey, and they talk about trauma and how early trauma impacts the brain, and it actually impacts the development of the brain. I don't want to get too down in the weeds on that, but so just do some work on ACEs. Another great resource is the Harvard Center for the Developing Child. It's a great resource on how trauma affects, again, brain development, and it affects long-term health. So I say that all of these, the police brutality, the day in and day out, I've experienced this even with my level of privilege as an African-American woman. It's exhausting, it's wearying, I'm not here to talk about my personal issues, but I'm just giving you as an example of someone who feels that day in and day out. I don't talk about it a lot, but it impacts me, and I just think we have to talk about it in our community because it does impact health.
Dr. Harris, thank you for that. I'm biased and 100% agree with you, but I think it was important for everyone to hear it, not from necessarily me, but to hear it from you. And I want to thank you for your response.
And this is Libby. I would also just piggyback on that, and I agree that was a great response. These are complex issues, and we are just one stakeholder in providing our voice on this issue. But I think we need to work with all stakeholders that have an impact, because this is not going to be easily solved. But I think that organized medicine needs to be at the table as part of it.
Absolutely, not ours alone to solve, and we shouldn't accept the burden, but does impact health, and everyone can do their part, right? Everyone doesn't have to do the same thing. I got a question. I did a radio interview earlier today, and someone asked me if I was going to protest. And I said, your action is your individual decision. Some people show solidarity by donating to a cause, or, you know, donating to a local food bank, or sending masks to protesters. So it doesn't have to be that overt act, although if that's what you want to do, that's fine. But again, all of these issues are so interwoven into health that I just think it's appropriate for us to speak out.
Thank you, Dr. Harris. I'm going to jump into another question here. This question is for you, Dr. Harris, what do you think about the study, and it looks like they cited here, Borba et al. From JAMA on April 24th of 2020, in which seriously ill COVID patients were given lethal doses of chloroquine, now being cited to claim that hydroxychloroquine is too dangerous to use.
I want to say one more thing about the other issue is that many physicians are small business owners, right? And you have employees. And I know you know that the health of your employees impacts how your practice runs. So I'm speaking maybe to a subset, but in any institution, you interact with other folks who are employees, and we want to keep our employees healthy. And I will tell you that if you have any African-American employees in your practice, they are not okay. Going back to what I said before, actually, I sent an email to our team, and I said, "You're Black," to AMA, I sent an email to Jim Madera, and I said, "Your Black employees are not okay, because I'm not okay, and I have privilege." And so it's also about making your organization healthy, your practice healthy, so you can take care of patients. So there's a lot of intersection there of why we should care about that. Hydroxychloroquine. I don't know if any of you, you never know what's going to be a hot take, but I was on CNN, and Wolf Blitzer asked me, he said, the president said, just take hydroxychloroquine. What do you have to lose? And I said, your life. And that became a hot take. I didn't know it was a hot take. I thought I was just talking about what we do as physicians every day. We talk to our patients about the potential side effects of medication. And we talk about the side effects that are more common and maybe less and non-life threatening. I prescribe, I'm a child psychiatrist, as many of you know, and I prescribe psychostimulants frequently. I see a lot of children with ADHD. And, some of the minor side effects are headache, a little nausea, vomiting. But the worst side effect is cardiac arrhythmia and death. And I talk about that. I cannot ignore that, even though it doesn't happen very often. So that's what physicians do every day. When we prescribe, when you prescribe or recommend, you don't have to prescribe this, but a baby aspirin every day. Although I think I just saw a study that said maybe that's not a good idea, but that's the great thing about science. It evolves. We still need, and so I said, you could lose your life. And I wasn't trying to be glib. That was just something, again, that we do every day. We need randomized clinical control trials. We've always needed them. We continue to need them before we prescribe a medication. And that really was the bottom line. And so we're getting more and more of these studies that talk about whether or not hydroxychloroquine, I think I just saw the one today that said it wasn't helpful in prophylaxis. I also am seeing, the study that came out of the Lancet, there are problems with that. But I've said, I think on every interview, it's too early. The first study where there were positive results, I believe they had 46 people in that study. And then each study, we get more and more. Of course, now this last study in the Lancet that had about 96,000 and a lot of continents, I'm hearing and reading that there are problems with that study. But my point and what I've said, we need the randomized clinical control trial, these early studies. Because everyone is so interested, normally, and you and I, the physicians in this room, we would hear about these early study results, right? We would hear about that just amongst our community. But right now with COVID, everyone is hearing about these early study results and getting excited. And we have to sort of temper that excitement and say, we are waiting for the randomized clinical control trials either way. But either way, this medicine could have serious side effects.
Great. Thank you, Dr. Harris. Next question is, what can the AMA do to increase membership in organized medicine for hospital-employed physicians, knowing that often their employers are not keen on physicians getting organized?
Well, we have made extra effort. Todd Unger and his team have made additional efforts. And by the way, I just want to say this too, this is not instead of, right? This is in addition to. I talked yesterday to the women of the AMA. We had a webinar with Sue, Barbara, and I, because as many of you know, for the first time in the history of AMA, we have 3 women as presidents until Sunday. The president-elect, the president, and the immediate past. So we did a webinar with the women staff of the AMA, and I told them, you know, they always ask, well, what advice will you give? And I have a few, but I said, and one thing, if somebody gives you an either or argument, run. Because it's typically both and we spend a lot of time in this country, is my personal opinion, arguing over either or when it's both and let's get on with developing solutions. So I think that's where we need to go on this. It's both and it's not just private practice solo. It's that diversity. And so Todd Unger has made an extra effort in talking with the employers. But I will tell you, even as we've done that, so we've gotten some large groups. Let me just let you know, and I want everyone to know, I don't want to say customer, but the person that we care about is the physician. We are a physicians organization. And so perhaps the larger institution is writing the membership check. Really, our goal is still about advocacy for physicians, but that's why with our integrated physician section, we're working extra hard to be of value to a diversity of physicians in this country, because we know that physicians practice in a diversity of settings. Now, it is impossible for any one organization to be all things to all people, but the hope is that people see the value in joining an organization that is committed, just like you do at the state level, is committed to doing the best we can for physicians, knowing that you don't always get everything you need, everything you want for your particular practice setting. But when we come together as a group, we can do a lot for the physician community. So I will tell you, I think we just keep talking about what we do for physicians. I get the, what have you done for me lately? That was one of my slides. I would talk about pre-COVID, and I would list everything that the AMA has done for physicians. And we still struggle candidly with telling that story. And we'll just need to get better and better at doing that.
Thank you, Dr. Harris. Another question here tonight. As a psychiatric physician, what do you believe our society needs to do to be better prepared to address the mental health needs of our nation, which we anticipate will continue to be greater moving forward as a result of the anxiety, depression, and social isolation effects from the pandemic and the other social unrest in our communities?
Well, clearly we elevate those issues now. I'm involved in a behavioral health advisory group, a work group out of DC. I am not on the group. I am the behavioral health advisor, but they are looking at what they can recommend to Congress on funding to make sure we shore up the mental health infrastructure. We have to make sure that we have to fight for parity. We continue that fight. That's not a new fight for the AMA. You all know that I chair the AMA's opioid task force, and we have been working very hard on parity. If you have not done this in Arizona, just to add to one more thing on your to-do list, I'm sorry, but chat with the insurance commissioner to make sure that all of the private insurers in the state are compliant with the parity laws, right? That's at the very least, because oftentimes, and we do this a lot in this country, a law will be passed and no one ever goes back to do what I call inspect what we expect. And I know the AMAs work with 4 states. We work with Pennsylvania, Colorado, I'm going to miss a state, North Carolina, and Mississippi. and work with their insurance commissioners. And we wanted to model, we said, okay, what would this look like so we can be a model for other states? And so hopefully, if you haven't seen that already, and I know you have, because I know you all are active and engaged, get that roadmap, work with your state insurance commissioner, make sure they are following parity laws, talk to them about reimbursement. You know, we are going to have to look at how we integrate mental health care into primary care and make sure that the services are adequately reimbursed. So those are just a few things, of course, that the AMA is already doing and we need to continue to do. And we need to do that now because we can't wait until the tsunami hits, right? Remember my points about preparedness, and that's another area where we have to be prepared to address.
And I just want to let our members know that off what Dr. Harris said, we do meet with the insurance companies right now about once a month with all of them due to the COVID pandemic. And so we'll make sure this is on there and we discuss it with them. They've been very open to our input so far. So we're continuing that dialogue. So thank you for that advice, Dr. Harris.
And by the way, I think you all know that we have done a lot of work at the AMA, and this is a little bit about physician health and a little bit off the track for the original question, but you know, the mental health needs, and we have to worry about, we knew, right, we came into this, another sort of pre-COVID problem, that there have been increasing suicides among physicians and among trainees, right? And so we also know about burnout. By the way, let's always make sure we distinguish conversations about burnout from conversations about mental disorders, right? Because burnout is not a mental disorder, and we cannot be afraid to talk about physicians having depression and anxiety and mental disorders. We should not, some folks said, well, let's just call it burnout, because physicians be okay to talk about burnout, but not be okay to talk about the fact that they have a major depression. So that is part of the issue, there's no question. And I'm not going to pretend that the environment is not always conducive to physicians sharing, right, and seeking help. So we have a lot of ways to go in that. So it's mental health for the public, but we also have to make sure that we are caring for our own. And we've seen this, and the frontline workers, again, with the day in and day out stressors and the death and the not having the equipment and all of that. So we're gonna have to be prepared to take care of the mental health needs within our own physician community and the broader community. But I do know some of the hospitals and systems put some things into place, and I don't know what's going on in Arizona, but there were wellness rounds, because again, we help others and we don't always take care of ourselves, and we have to make that routine and normal. And so some of the systems and hospitals I know in New York, they just built in wellness rounds and wellness checks, so that it's not even the doctor after working, this would be all the health professionals though, but after working a shift had to then call for help. But it's, no, let's debrief, let's talk about this. It's wellness rounds, I'm gonna check in, this is part of our day. And so we'll have to make sure we build those things into our systems, as well as encourage help seeking.
That's a great answer. Thank you. Next question is, Dr. Harris, what's the AMA's position on the safety of medical students around the country returning to rotations and direct patient care, despite the COVID infection rate being far higher than when lockdown was initiated?
Yes, we did a lot of work actually around medical students. We have a very active medical student section, listening to their concerns, just a lot of disruption, as you all know, partnered Susan Skocialak on our team, constant contact with AAMC. And of course, we also did the same for our residency trainees, so constant contact with ACGME, just conversations about the test. And as you all know and saw, a couple of schools graduated their medical students early. And so we put out an entire resource guide for students and trainees, making sure they were safe, making sure they were appropriately compensated, making sure they had places to live, making sure we said, don't bring students into an environment where they don't have the adequate PPE. What about health insurance? Okay, if they're in this limbo, and are they trainees yet or not? But so whatever. So we put out an entire resource guide for students, and our education team was greatly involved and will continue to be. And so there, I think, is one even specific resource guide on the website for medical students. So if you really want to know all the details of everything that we've done, I would encourage everyone to go to our COVID-19 resource page.
Thank you, Dr. Harris. Looks like we have time for one more question from the audience. When a vaccine becomes available, has the AMA thought how the distribution of the vaccine will be accomplished in an equitable and fair fashion? Even something as simple as the availability of needles and syringes needs to be planned for now, not when the vaccine hits the market.
We agree. And of course, the AMA won't be involved in that decision, but certainly guiding. This, I think I've seen some promise in this. Again, even as perhaps the vaccine there's a timeline that might, it's okay to be ambitious, certainly. So we'll just say that. But I do think that the project that the NIH has, where they have, multiple partners working on, several candidates. I think there might be 100 vaccine candidates in trial. And I know the NIH is doing a lot of coordination, and they are also thinking about not only the development of the vaccine, because I think, and we know this in the physician audience, when they talk about developing a vaccine, they're talking about developing a vaccine, right? But after the vaccine is developed, then there's the manufacturer, right? The production and the distribution. Does it have to be refrigerated? Is it one candidate? Does it have to be injected? Is it, oral or whatever? And so all of those, and I do think that it appears from what I've seen in the leadership, Dr. Fauci, Dr. Francis Collins, the reports, that I hear, that they are looking at that at the same time, and they are having the companies think about production and distribution at the same time that they are thinking about development. And I think that is wise. I think that's smart. And so I do think that that is happening now.
Great. Thank you, Dr. Harris.
But I will say, I have said, because the most important part of that question, I think, equitable distribution. And that is going to be a concern. And let's not say just because the AMA says vaccines should be equitably distributed, that it's going to happen. And so here's again where organized medicine can come into play. We can continue. You can, with your senators and congressmen and women there, talk about it now, right now, before, because usually we talk about equity later. So we say, okay, we know that we're early, we're having these conversations now. We have to make sure that vaccine is, who's thinking about that plan, who should get it first, making sure that maybe the most at risk should get it first. I'm not saying that is the case. It will depend a lot on what kind of vaccine and how it's performed in safety trials. But I think the key thing is that we are saying right now, the expectation is equitable distribution. Not who you know and how much money you have, but some sort of plan for equitable distribution.
Great. Thank you, Dr. Harris. Dr. Goldberg?
Yeah, because we're near the end here. So I just wanted to, again, extend our deepest thank you to Dr. Harris for taking the time out of her very, very, very busy schedule to talk with us for an hour, and to do it late at night from the East Coast is really appreciated. Just again, thank you for all the hard work you've done on behalf of medicine throughout the year, especially these last couple months, representing us to our highest levels and showing everyone what medicine really can be in this country. We thank you for taking the time to educate our audience. I thank our audience for coming and everyone else involved. And just wanted to say thank you from all of us. We really appreciate it and commend you on a fantastic year. And I'm sure you'll happily hand it over to Dr. Bailey for a little bit, but we thank you for all your work you've done this year.
Well, thank you. It's been my pleasure to be with you this evening, and thank you for allowing me the opportunity. Stay safe.
Great. Thank you, everyone. Have a good evening.
Good night.